Welcome to Talk of the Town. We are at MiraSol Health. We just had a ribbon cutting for Rays of Hope Behavioral Health. We have the CEO with us, James Dismond. James, it was very exciting. Tell us a little bit about the program.
Yeah, it is super excited. Rays of Hope is a program of MiraSol Health, and this was thought of and brought to fruition because we found a gap in services. And that's when you're going through a chronic serious illness or even end of life, you need some extra layers of support, navigation of the healthcare system. The emotional weight can be really heavy for everyone involved. And so this program embodies those supportive services for our patients and patient family members.
So for an organization such as MiraSol, is it normal to have a behavioral health component, or is this unique?
So we would have to say it's unique. It's unique to us. And this is where nonprofit hospices are diversifying to, one, stay relevant, but to meet community needs. Size is very important for an organization's financial stability, and this helps us meet a need while helping us stay financially viable for 43 more years.
Very good. Now, who will you be serving, the patients and families of MiraSol?
Yeah, it's really important. This is not general behavioral health.
Right.
It's for our current patients and patient family members, or anyone who's struggling with a serious illness. We would then wrap our services around them and support them holistically.
So talk about the various services you'll be providing at Rays of Hope.
So Rays of Hope is general counseling for people with serious illness, chronic conditions, and anyone who needs help navigating that healthcare system. But it's important that a family member or someone be a patient of our services for us to provide this support.
And I love when you talk about your team, your staff. They're just amazing, and they're broad-based. I mean, they're clinical, non-clinical support, and your volunteers. Talk about the ones that were standing behind you at the ribbon cutting.
Yeah, so they do the hard work, right? I get to be strategic vision and be the motivator, but our team is really doing the grassroots community chronic illness care. And so this team is now made up of 138 volunteers, over 5 physicians, 4 NPs, behavioral health therapists, a licensed social workers, and administration staff. So we've went from a staff of 21 to 28 all the way to 51 now, and that's because of the patients we get to serve and the community that supports us.
And you mentioned you're serving now about 200 patients a day.
Yeah, we have been serving over 200 patients a day now for more than a year and a half, and we're here to serve more.
And the impact that Rays of Hope hopes to have for our community at large.
So we are filling that specialty gap for those with chronic illness, and it's really important that we fill that gap because those people who are experiencing a chronic illness or have a behavioral health issue associated to a chronic care condition needs the extra support, and we walk along with them with that journey, and we're just super happy to be present.
So you said this has been a long time in creation. Yeah. So a lot of folks coming together, a lot of plans. So today is a culmination. You broke the ribbon. The program is now officially open. Is that correct?
It is. It's actually already been open.
Okay.
But we did a soft launch, a pilot, and we're just really excited to bring this forth to the public so they can hear about it. Because the more you know, there's power in knowledge and knowing that these supportive services are here. Actually, during our ribbon cutting, we actually just got 3 referrals from a partner that noticed that they have patients that need this support. And
you're expanding and have expanded to Hampton and Colleton counties.
Yeah, the reason why we strategically aligned with how we're going to do a launch is because we want it to be around forever. And so when we launch a program, it's here to stay, and we're now serving 4 counties, Beaufort, Jasper, Colleton, and Hampton.
And I see you all on the national stage a lot. That's because you're doing a lot of things right, James.
Yeah, we're super fortunate to take not only just the locality seriously, but to understand that there's a larger conversation happening. And that's that our healthcare system can be a lot better for everyone involved. So we need a national presence to facilitate our opinions and our viewpoints on policy. And that gets passed down to the states and then to the localities. So we are present locally, regionally, and nationally, and we will be as long as we're here.
Great. Well, congratulations again for your ribbon cutting today. Rays of Hope Behavioral Health. And that's it for Talk at the Town.